Hello, I'm Glenn W. Hunter, and with me is Dr. James George of Excel Physical Therapy and Wellness in Redlands, California. Today, we are going to leap right in and talk about ankle and foot trauma. Dr. George, we're going to get into ankle, we're going to get into feet, and I'm looking forward to your comments and the insight you're going to bring. So let's jump right in.
Thank you for having me, Mr. Glenn Hunter.
Indeed, indeed. So ankles and feet are unstable joints, but they're essential to walking, running, and standing. How does the ankle structure support people with regards to walking, running, and standing?
Wow, that is a wonderful question. Ankle and foot is an amazing complex structure. Imagine your whole body weight is actually supported by the ankle, especially when you're walking. The first step you take, right? Your foot is on the floor, your body weight is putting pressure on the foot, and there is a term called floor reaction force. The ground is putting pressure on the foot. So it's like it's being hit from both sides, all right? Like Newton's third law, for each and every action, there is an opposite reaction. So the foot, when it hits the ground puts an equal pressure back onto it. Now the foot needs to be, the ligaments in the foot and the muscles and the joint integrity issue is very important. If any of these, the ligaments, the muscles, and the joints or the nerves which are supplying the area are affected, that can cause severe pain, that can cause debilitating pain and a difficulty with standing and walking. That is a very important function for anybody.
Indeed, indeed. So in performing that function, what are the key body parts that are in the ankle and foot?
That is a good question as well. So let's look at the foot here. The foot has about 26 bones, depending upon, some people have extra bones, like we call it the sesamoid bones. All right. So if you look at, this is the lower part of your leg, and this is the fibula, the tibia, and the calcaneum. All right. And there is a dome-like bone inside here. That's the talus. And then you have your cuboid, and then you have your intertarsals. All right. First, second, and third, and then you have your metatarsals and your interphalanges and your phalanges, the toes. Right. Mm-hmm. So all of these are actually held together by very strong ligaments, and you have a really strong plantar fascia and ligaments under here, and you have strong muscles which hold this, and the ankle ligaments on the side and the front, they all hold this ankle and foot structure intact.
Okay. So with those things happening, can you elaborate a little bit more how the muscles play into the structure of the ankle and foot?
Muscles, we divide muscles of the ankle and foot into two main types, the intrinsic and the extrinsic muscles. The intrinsic muscles, they start from the inside body of your foot and the end in the foot. All right, these muscles are more of a kind of, along with the ligaments, they act for stability. All right, stability of this foot, the integrity of the foot joints, and the extrinsic muscles, they start from the lower part of your leg and then they go into your foot and the ankle. Those are called extrinsic muscles. Now they work together in unison, all right, in coordination, to provide not only stability but mobility for you to walk, jump, run.
Okay. Dr. George, a lot of injuries are ascribed to ankles and feet. What is the difference between a sprained ankle, a twisted ankle, and a broken ankle?
That is a very good question. Sprained ankle is, we divide the ankle injuries into, especially the ligamentous injuries, into 3 grades: grade 1, grade 2, grade 3. Especially grade 1, grade 2 is a sprained ankle. Grade 3 is kind of almost all the ligament is torn, and so the ligaments in the outside part of your tibia calcaneal ligaments, they are injured. Your foot is turned inwards, and your deltoid ligament, when that is injured, which is on the inside part of your foot, that causes an eversion injury. So yes, those injuries, even if it is a sprain, grade 1, grade 2, you need to get professional help. And fracture can also happen at the lower end of your fibula, or at the lower end of the tibia, along with the ligamentous injury, or fracture of the calcaneum, or fracture of your talus. Uh, or the metatarsal area, when somebody in the military, or somebody takes up hiking new, and they can end up in stress fracture. So any injuries can be ligament or fracture. So it's good to go and seek professional help rather than doing those exercises by yourself.
Outstanding. I mean, that is a lot of opportunities for trauma from just as ordinary human beings, you know. But I think one of the other things that I wanted to reinforce, you know, is you think about, you know, athletes, and again, athletes of all shapes, sizes, skill levels, they have to be very much aware of ankle and foot injuries. I mean, and there's a lot of them, as you just sort of identified them. What is the most common sports injury to ankles and feet?
No, typically, as I said, any contact sports, right? Soccer, football, basketball, anything which involves, we call it, involves close kinetic. Close kinetic is the foot lands on the floor, right? Jumping, anything involves jumping or running. All of these sports can cause injuries to the ankle and foot.
Okay. So another thing that's very specific to feet and ankles are women's shoes. Certain women like to have very fashionable, sometimes high-heeled shoes. And often they bring unique challenges to their ankles and to their feet. What trauma to the ankle and their feet, for that matter, is unique to women's shoes?
Yes. Yes, women, you know, they like wearing high-heeled shoes, especially for their professional meetings and, you know, for their business. You know, what is important is they wear those for the meetings and the business time, and then once they come back to their desk, it's better to wear their flats. The reason why I'm saying is if they wear like 8 hours a day, high-heeled shoes, they're going to end up in having their body's weight on the forefoot, on the front part of the foot, that could cause callus in the metatarsals, when callus in the hallux or the big toe. Mm-hmm. That could cause tightness of the muscles, even cause back pain. And cause stress on their plantar fascia, causing heel pain, plantar fasciitis. So all these things can happen if they are going to be stressing the ankle and foot by wearing heeled shoes for a long time. Yes, they could wear it temporarily for some time, and then you know, it's better to, once they come back to their workplace or their desk, change to flats is a better way to manage their foot and prevent from injuries.
I think that's very valuable to bring that insight to particularly to ladies who find themselves very fashionable with their shoes. So, but another point that I wanted to bring up is, what techniques are most effective in strengthening ankles and feet?
Yeah, you know, if there is an injury to the ankle and foot, I would suggest not to do any exercises by yourself by watching YouTube videos, because as I said, your ankle and foot is a very complex structure. You need to go have it professionally evaluated, you know, because if there is any injury to your ligaments, or if there could be even a mild like hairline fracture at the fibula or at the tibia or any other. There is a term called stress fracture. It could happen in the metatarsals. You know, all of these can happen, and you go and do some exercises which can prevent the healing of these ligaments and the fracture, and you could exacerbate your pain. So after any injury to the ankle or foot, or even a pain starts, try not to start right away doing exercise, but get it evaluated. With physical therapists are trained, we have direct access and you know, first contact practice in California. You can also go if once we evaluate, if we see that this cannot be treated by physical therapy, we'll refer you to an orthopedic surgeon or your primary physician. You can also you can also go to an urgent care, get evaluated. Eventually you would be needing physical therapy because your foot and ankle is a very complex structure. It needs an evaluation and finding out where the problem is, whether it's the muscles are involved, whether the joints or the ligaments, or even the nerve in your foot, and treating it according to the evaluation would help recovery without complications.
So in totality, across the board, what advice do you give your patients to strengthen their ankles and feet, particularly after a mild injury?
Yeah, after mild injury, yeah, that's a good question. Start right away. The term is rise, rest, icing, compression, and elevation. All right, that would help. There is swelling. It would help decrease the swelling. You could use some compression stockings just to decrease the swelling. Even use some ACE bandage to keep in position. But again, that is an acute. You just manage, decrease the swelling and pain, but still you need to go see a healthcare professional who is trained in evaluating and treating ankle and foot right away.
Okay. I mean, is there anything they should avoid specifically as they're trying to nurse back to health?
Specifically, you see, it is after an injury, it is better not to put weight on that foot because you never know whether it is a fracture or a ligament, grade 3 tear of the ligament, so which needs immediate, care.
Mm-hmm.
So typical thing is nowadays people can use crutches and not weight on that foot, or if they are elderly, wheelchair, or there are scooters where they put their leg like this and you can just propel yourself forward. So get something like that after an injury. Try not to walk on it because it could make that problem worse. And go and get help. Go to urgent care. Go see a physical therapist. Go see an orthopedic surgeon. Get that evaluated and treated accordingly.
Wow. I think it's very important at the end how you emphasize the fact that you do have to take proper care, see a physical therapist, but to make sure that healing is taking place as opposed to finding the latest fad that may do more damage than good. And with that in mind, Dr. George, I thank you for bringing that kind of illuminated perspective to healing. Ankles and feet are tricky, and as you pointed out, you can't get along without them. You have to have them if you're going to be propelling yourself in a normal form and fashion. And I appreciate the wisdom that you brought today for our audience.
You're welcome. I'm very happy that some information will be out there to help people with ankle and foot injury.
Good. And as you've spoken to the audience and they want to reach out to you, how do they get you?
Yes, you can reach us at 909-792-5050. Our business name is Excel Physical Therapy and Wellness. We are based out in Redlands, California. You could also visit our website, Excel Rehab and Wellness, and you can Google us, Excel Physical Therapy and Wellness. You can see our 5-star reviews, and also you have a lot of contact information and information about how to reach us.
Outstanding. Again, Dr. James George, I'm Glenn W. Hunter, and always I encourage you, be safe.
Thank you.